virus did come to our city, to New Haven, Connecticut. We are located about halfway between New York City and Boston. And we're right on the Amtrak train line and one of the principal stops of that train line. We're also right on a heavily trafficked thoroughfare, the so-called Interstate 95, which goes all the way from New England to Florida and connects New York City and Boston. A very heavily traveled route. So we were not surprised that when the virus emerged in the state of Washington and in California, and then ended up in New York City and resulted in a huge outbreak, the worst outbreak anywhere in the world. It didn't surprise us that it would come to New Haven, and we tried to get ready for it with ramping up of personal protective equipment for our healthcare workers and plans for contact tracing. We hoped to have access to testing, but that has been very slow to come. And then mobilizing for the physical distancing, the hygiene campaigns, hand washing hygiene campaigns, the travel restrictions that have been tried elsewhere in the world. So we can look at the rest of the world. We can see what worked well and what didn't work so well. So two of the examples we've looked at are Wuhan, China, and Daegu, South Korea, where although they had terrible outbreaks with a lot of human suffering and even death, they were able to get their local spread under control. So how did they do that? They did that with rigorous travel restrictions, with physical separation, with a lockdown of society for a number of months, with hygiene campaigns, with aggressive use of personal protective equipment and universal mask use. And we saw a high degree of success in both venues. So this gave us a model. They were less aggressive in Iran, in Italy, and in Spain in their response, and they paid a terrible price with much more transmission than we would have liked to see. So we did not have a travel lockdown. We didn't cordon off New York City and deny people entry and exit the way they did in Wuhan. So we did not achieve the efficiency of control. We were also very late to mask use. Since we had a shortage of personal protective equipment for healthcare workers, we didn't have enough N95 and surgical masks. We ran out. Then it was deemed that we should reserve these high quality masks for healthcare workers. And some of us were arguing that the dust masks, the hobby masks that you can buy at the hardware store that workers use, or homemade masks that use a dense fabric, would be a reasonable thing for citizens to use. But some people argued against us. They said that there wasn't a sufficient evidence base that these masks worked well. So we had these debates, these academic debates. And I was a pro-mask advocate. I felt that some protection was better than no protection. And I believed that stochastically or probabilistically, one would reduce droplet exposure using a mask, even if some of the aerosolized tinier fractions might get through the mask. I still thought that one would reduce infection risk, but not everybody agreed with me. Finally, CDC did change its recommendation to recommend mask use. But, you know, in Asia, mask use is very popular because of air pollution in some of the big cities, and people are used to wearing masks. So they wore masks right away and with high degree of fidelity. And I would have loved for us to do the same. Even today, I went out to buy some food yesterday, and everyone was practicing physical distancing, and probably 80% of the people were wearing masks. But 20% of the people were not wearing masks. And we're in the peak of our coronavirus transmission. Just this last week has been our peak. We've had over 400 people in our hospital with coronavirus, and 100 of them have been in the ICU, and over 70 of them have been on a ventilator. And you would think that at the peak of coronavirus transmission in a small city like ours, that people would take this more seriously. So these measures help control the virus if they are adhered to. If they're not adhered to, then you have chinks, and you have chinks in your armor. You have holes, and you have the possibility of people continuing viral transmission cycles. So I personally would wish that the U.S. had more social discipline, if you want to call it that way, where we all agree to do something and we all do it. For example, we should all drive safely, in our cars. Yeah. We should not litter on the streets. We should take care of each other and watch out for each other. And that part of that is to adhere to these epidemic control measures. But unfortunately, we drive too fast. Some people drive through red lights. People are not necessarily, they litter, and they're not necessarily helping each other. So we are a little bit of an undisciplined society, and we pay a price for that at a time of a pandemic.